This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
And welcome to the human side of healthcare. Steve Love, along with Thomas Miller. Welcome. We're delighted you're with us today. And we're going to take this first segment and kind of talk about what's on everyone's mind, what's going on here, not only in North Texas, but across the U.S., COVID-19. Thomas, here we are, another week.
I'll bet you've never been asked this whole week, Steve, how long is this going to last?
Yeah, I would say I'm asked that at least 10 to 15 times a day, and I really wish I had an answer. All I can say is we're going to be in it for a while. We're going to certainly work together. The people of North Texas deserve so much credit. They have done a great job of social distancing. They've done a great job of staying at home. We're definitely flattening that curve of infection. And Thomas, that's so important. If you can flatten that curve of infection and the infection rates, then you're going to have less people getting infected, less people going to the hospital, candidly, less people dying, and less people having to expose first responders and our healthcare heroes working in hospitals. So, this really is a team effort. And I just want to give kudos to the people that are truly doing their best and abiding by what our public officials have asked us to do.
We've definitely had some larger numbers in the DFW Metroplex just this week, as you predicted. And yet we look at other places in the country, New York and Louisiana now, it has crept in. Are we a little bit ahead of things here? And do you think the efforts that we got on to sooner and before those communities did might be having a positive impact here?
Yes, and yes, to both of your questions. Number one, I think we are a little ahead. Unfortunately, when you look at Seattle and when you look at New York and now Detroit and Chicago, there are some places that really were a little ahead of us. But it's going to be coming to us towards the end of April, first part of May is when we're looking at models for the surge. But also, Thomas, we did get after it quicker. We put in place social distancing. We put in place stay at home. We put in place look at essential businesses. And our heart aches for the people whose businesses have been closed, especially the small business owners. But thank you for helping protect the public health. Let me give you an example, Thomas. Good friend of mine, his name, I don't mind telling you, is Wright Lassiter III. Many people here in North Texas know Wright. He's a fine man. He's an excellent hospital CEO. In fact, in his early training, he worked at JPS over in Fort Worth. He is now the president and CEO of the Henry Ford system in Detroit. This week, over 700 of his employees, I didn't say patients, I said employees, have tested positive for COVID-19. Now, can you imagine you're running a big hospital system, and that is a large system in Detroit, and you're trying to help the community, treat the community, and a sizable number of your own workforce gets infected. That is the kinds of things we are trying to avoid here in North Texas. So when you do stay at home, when you do social distancing, you're doing your part, and we thank you.
So, that's a good point. We talk about the peak. So we've heard the peak's coming, the peak's going to arrive. When will we know it's here? What will it look like? And then what happens next?
That's an excellent question, Thomas. And, I talked to epidemiologists, infectious disease doctors, and, no model is perfect. It's kind of not only a model to examine infection rates, looking at age, looking at number of people that'll be hospitalized, how serious and acute you think the patients are going to be, or they're going to need a ventilator. There's so many variables that go into it. But to answer your question, when you really look at the models and you hit the peak of those infection rates, and you hit the apex of the model, that's when hopefully you're going to then see the other side of that slope, where you start to see fewer and fewer infections, fewer and fewer deaths, fewer and fewer obvious hospitalizations. And from that, you are going to say, hopefully we've reached the peak and now we're coming out of this. Coming out of it is something we've really got to look at. We're going to have to all work together too. You don't want to come out so soon that you have a resurgence where it comes back. So I think we're going to have to learn from Seattle. We're going to have to learn from New York. We're going to have to even learn from China and Italy. How do you come out of this once you hit it? You know, it's not like a water faucet where you could turn it on and off. I think it's going to be a gradual thing. It's going to have to be well orchestrated. We're going to have to all work together as we open up businesses, as we get back to normal. What I can't answer is, how long is that going to take? But if the models are correct, and towards the end of April, first part of May, we do hit that apex and we start coming down the other side, at least we'll be moving in a positive direction.
Your personal opinion here, after this is over and we get to that point, will life ever be the same for a long, long time?
You know, I don't think it will, Thomas, and I'll give you a great example. I can't speak for other people, but I'll speak for myself. I really, going forward, and I'm not going to be rude, I'm probably going to wrap my knuckles or take my elbow when I greet people. I'm going to kind of not shake hands as much as I used to. You know, that'll help prevent the flu. Forget COVID-19 for a minute, just other things. I am going to wash my hands more frequently. I'm in the healthcare business, so I've kind of been trained to continually wash your hands and obviously use some type of hand sanitizer. But I'll tell you something else I'm going to do, Thomas. When I check into a hotel or a motel, I am going to clean and make sure that I at least wipe down the remote control that goes to the television. I never used to do that. I'm going to start doing that. And I just got to tell you, I know personally I'm going to change a lot of health habits. Do I think other people? I think they will. Do I think people are going to think a little more about, hey, viruses, what are we going to do about this? So yes, things are going to change.
Yeah, I tend to totally agree with you. I know for myself, I've kind of been going through my mental list of things to do and not do in the future as well. Well, that's a good segue to what we're going to talk about next. When we come back, we're going to talk with Curt Hazelbaker. He's the CEO of the Metropolitan Dallas YMCA, but it covers a wide area, the whole Metroplex basically. And they've been affected by this, as you can imagine. He's going to tell us what they're doing now, and we're going to also talk about some blood drives that are going on in the area, both with him and later on in this program, which is very important because those are critically low. We're coming right back on the human side of healthcare here on KRLD. Stay with us. We'll be right back.
This is the human side of healthcare on 1080 KRLD and the radio.com app, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
And welcome back to the human side of healthcare. Thomas Miller and Steve Love. And we're going to talk today as we continue our discussion about COVID-19, what it does to the community. And we couldn't have a better person than the president and CEO of the Metropolitan YMCA, Curt Hazelbaker. Curt, welcome to the show.
Thank you, Steve. Appreciate being given the opportunity.
You know, as we think in terms of the Metropolitan YMCA, can you quickly tell our listeners what geographic footprint you cover here in North Texas?
Sure. Our furthest Y north is in Anna. Furthest Y south is Waxahachie. We go east to Rockwall, and west is really the Tarrant County line. We've got a Y in Flower Mound, Coppell, and Grand Prairie are the furthest ones west.
And, I know the YMCA, people think in terms of the Y with the good programs you had, obviously physical exercise, movement. You do a lot of preschool and after school. You do so many things. What has COVID-19 done to the Y? What's going on, and what programs have you had to close? Can you expand a little bit?
Sure, Steve. We've had to change our operations drastically. Early on when this came out with the recommendation for closure, we closed all of our physical locations on March 16th. So what people are familiar with, using the Ys to exercise, all that stopped. The majority of our programs did stop as well. But what we were able to do, and I think what the Y does so well, is we pivot to where the needs are in the community. And so what we have shifted to is we have operated 7 emergency child care sites. So those on the front lines, first responders, healthcare workers, grocery store workers, whoever's got to be working now, we've got child care available for their kids at 7 locations. Very safe environment. We follow social distancing. Our staff are wearing masks. Hand washing procedures are very strict. But the kids are still having fun. The kids are still learning. We're still keeping them active, and the parents don't have to worry about their kids. So that's one area that we've shifted to, Steve. The second one is food distribution. We're doing this at 7 different YMCAs, where we are working with local providers to provide food. An example of this is at our Park South YMCA. The first Saturday they did that was 3 weeks ago. We gave out 6,000 pounds of food to 500 families. And what was neat is the families came, they drove, they walked, they rode their bike. There was a woman that rode her motorized wheelchair to the site to get food. And Park South really steps up all the time, but really has stepped up through this. And then the last thing I'll share with you, and you would know this, there's a critical blood shortage right now. So we had reached out to the American Red Cross, offering our YMCAs as sites for blood donations. Their mobile units are all deployed. So they are using 5 of our Y gymnasiums to draw blood starting next week. So it's another way we can help the community out. So those are just a couple of ways how we have pivoted, Steve, to meet the needs of the community.
I think that's fantastic. And you mentioned blood drives. And, later on in this show, we're going to have a segment where we're working with Carter Blood Care also. So you're working with the Red Cross, Carter Blood Care. It's just tremendous need for blood in this time. Curt, I really like your word pivot. You look at what's going on. Your business, for the most part, gets closed down, and yet you pivot to help the other needs within the community. That really dovetails perfectly with the mission of the YMCA. And, I think as we look towards the future and we look towards, as we come out of this terrible virus that's hit this country, and we don't know when that'll be. It could be 6 weeks, 8 weeks, 12 weeks. What do you think, as you come to the other side of this, will be the future for the Metropolitan YMCA?
We've obviously given a lot of thought to this, and we touched so many lives. Last year, it was 250,000 people that we had some contact with. They were a member, a program participant. And we know when we open our doors, we're going to have a group of people that are just excited that we're open. They're going to come back in, jump right back into their routine. And like we hadn't closed, they'd just be glad to be back. Then there'll be a subset, and we don't know how big that subset is really going to look at how we do things differently. Our social distancing, as an example, if you're in any of our facilities, our group exercise classes are usually fairly crowded. So we'll look at limiting the size of classes and spread people out. Our equipment is relatively close together. So we'll either separate that or we'll turn off every other machine to keep the social distance. You'll see us cleaning more frequently. There'll be more cleaning products available, wipes, disinfectant sprays, so that our staff are cleaning. We'll be encouraging members to be cleaning. And we'll really look at how we open our facilities. I don't know that we're going to be able to open everything at once. I think we're going to have to stagger our openings, really just to make sure we have systems in place that we are comfortable with what we're opening back up, that it's a clean, safe environment, that we're doing our part to keep the spread from reoccurring again, and keeping our facilities clean. And I think our members expect that and will appreciate us taking those steps.
You know, Curt, the good work you do and give back to the community, it really touched me when you told me an incident, and I think it's good to share it with our listeners if you don't mind. Obviously, when you had to shut down, people can suspend their memberships, etc. But you told me about an individual that saw where you were giving out food to children and that you were doing things to help the first responders through daycare. And the letter they wrote you and paying their dues. Would you share that story?
Sure. That was terrific. And Steve, that was one of many. But the letter you're referring to was a member at our T. Boone Pickens YMCA downtown. And he sent an email back in, or sent an email into our executive director and said, "My wife Trish and I want you to triple our membership dues because you're feeding kids in the community and keeping staff employed. That's a good thing." And just that came early on in this. That was probably the second week after we had closed. And as you can imagine, we were dealing with a lot like everybody else is. But you get a note like that and subsequent notes from our members or participants that are just so appreciative. The notes are so uplifting. And it really reminds us this is why we do this work, because the impact we can make, and there's a need that's out there, and the Y can step up to help fill it.
That's terrific, Curt. And this program is called the Human Side of Healthcare. And when you look at the social drivers of health, and that includes housing and food, et cetera, the YMCA helps fill that gap related to the social drivers of health. We could continue this conversation, but we're getting short on time. So let me just say this. You've got many listeners in our podcast. What would be your final word that you would like to tell our listeners, Curt, about the Metropolitan YMCA?
We're going to get through this. The Y will come back. The Y's been here for 135 years in Dallas, and we have adapted over time based on what the needs of the community were at the time. And we will continue to do that. We will be here. We will, in many ways, look the same. In some ways, we're going to look different, but we will still be here serving Dallas. And we just appreciate the support we have gotten and continue to get, and look forward to where the journey takes us once this virus is over.
Curt, it's just been a real pleasure having you with us. Thank you for what you do for the community. We're grateful to the YMCA. I wish we had more time. I'm going to kick it over to Thomas now, and he's going to tell us about our upcoming segment.
And we'll remind everybody, too, of our podcast, which is available on all the major podcast players. That's the Human Side of Healthcare podcast. And we're going to come back and talk to Hazel Thomas. She's the Director of Pastoral Care for Texas Health Resources. And Steve, I know that if people are having to go to the hospital now and their loved ones are in the hospital and they can't be there, it's one of the toughest components and most emotional parts of this situation, but they can still access the chaplains.
Absolutely, and those chaplains are there to help everyone.
So when we come back, we're going to talk to Hazel, and also in that podcast episode, she talks about how you can become a chaplain if you're interested in that as even a second career. So maybe as we wind things back up, some people will even want to do that. Quick break, back with Hazel Thomas on the Human Side of Healthcare here on 1080 KRLD and radio.com.
The DFW Hospital Council, along with our over 90 member hospitals in North Texas, are proud to bring you the human side of healthcare with Council President and CEO Stephen Love and co-host Thomas Miller.
And welcome back to the human side of healthcare. Steve Love along with Thomas Miller. You know, we conducted an interview really prior to COVID-19, but there are so many things that we learned from that interview, pearls of wisdom. And we talked to a chaplain. In fact, we even asked, what are some of the things that you do in a typical day as a chaplain? Such good advice. You know, Thomas, we need chaplains. We need religion. We need faith as we face COVID-19.
You know, I had a friend die from this, as you know, and the saddest part is that he died by himself and couldn't have his family not only there, but also helping to lead the care and being sure that what was done for him was what needed to be done. So if you face that situation or a loved one faces that situation, we certainly hope that that's not the case. But if so, chaplains are available. And we're going to talk now to Helen Thomas. She's the director of Pastoral Care at Texas Health Resources. She's been doing this for over 25 years. She helps families when they come to the hospital, both in the good times and the challenging times. And she's going to talk about that now. And like Steve said, hey, Helen, what is a typical day like for a hospital chaplain?
Well, we don't always know from day to day what our day is going to look like. However, we do know that there are usually areas within the hospital that are assigned to each chaplain. And so we will go make rounds, ask with the nurse and the other disciplinary team, do you have a referral? Is there a patient or a family member that you have seen in the last 24 hours that would appreciate having a chaplain stop by? And that's part of what we do is we work from referrals. But we do go to all parts of the hospital. And then, of course, if something happens within the emergency department, then we respond to that and head toward there.
When you're in a hospital, especially acute care hospital, sometimes there are just very exciting and happy moments, like in labor and delivery and newborns coming to this world. But also in hospitals, sometimes you see people on the very worst days of their lives. What is your overall strategy in helping those people cope when they're having one of the worst days of their life?
Yeah, I agree with you, Steve. Most of the time when people come into the hospital, it's not by choice. The majority of the time, something unexpected has occurred, and in their life, it is considered a crisis. And so we want to be there and help them in the midst of that crisis. And the strategy that we really do rely on is we consider ourselves to be the experts in the human spirit. While pharmacy are the experts in medications, we really focus on the human spirit. And what can we do to help that particular person tap into their own strengths and tap into their own belief system to help them try to find meaning in the midst of the crisis. And then also find that hope so that they can move forward, and whether that's the patient or the family that's dealing with the crisis.
You know, your work has got to be complex too. And by that, I mean, we've had segments on this show where many times patients speak different languages. Many times patients are from different cultures.
Definitely.
You have to really be non-denominational because you want to give hope to people. You want to help them cope. You want to bring comfort and care to them. So that's got to be tough when you're dealing, particularly if someone's agnostic or even an atheist.
Right. We don't always know what we're walking into when we go into a patient's room. We're asking if we can be invited in to their situation. We want to be their support to them. Like you said, we definitely live in a multicultural society that includes, like you said, language barriers might be different. Their faith and their culture is going to be different. But what I am there is not about me, but is about them. And so we really do want to make sure that we are helping the individual and focusing on what it is that helps them find meaning and purpose in the midst of the difficult time that brought them into the hospital.
You know, I mentioned a moment ago about sometimes there's celebrations in a hospital.
Yeah.
Surgery went well.
Yeah.
It was successful. Obviously, newborns. Are you called in to help celebrate and be part of that as well?
We are, and we are very happy to do that. Some of our hospitals within Texas Health Resources provide different types of blessings when babies are born. That might be a verbal blessing, going in and saying a prayer over the baby, or some sort of ritual that the family finds meaningful. But then also some of our hospitals have printed out a card that provides a blessing, a written blessing for them, and it's a keepsake that they get to take with them. So we really do enjoy being a part of the celebrations. Sometimes there are, maybe on the oncology area, there are patients who have gotten into remission. They've gotten news that they have gone through all of their cancer treatments and things are looking good, and the doctor has said, you're in remission. And so we like to partner with the rest of the staff and that patient and family and celebrate that, whether that's a ritual of ringing a bell or, taking off something and saying, this is not me anymore, and throwing the gown away and acting like they're not a patient. And, I get to be a person again. I'm not a patient anymore. Whatever it is, however they want to celebrate, we want to celebrate with them as well.
I can only imagine the life of a chaplain from happy moments to sad moments.
Yeah.
And, it comes to mind, I just can't fathom what the chaplains went through at Sandy Hook, when they had to deal with
Right.
those kind of situations.
Right.
And not something maybe that nationwide, but a bad car wreck where family members lose their lives, where there are survivors. You have to sometimes feel very stressed at the end of the day. How do you cope with that stress?
Well, really, everybody does it differently. In my history of being a chaplain, I have worked in disaster response. So there are places that I have been, specifically in New York City after September 11th, that I did a lot of work and processing with the different victims and families. So I understand acutely what it's like to go through a major disaster. But then at the same time, how do I cope with that? And that is a personal question. I do rely heavily on my faith. Music is a huge part of my life. My parents, their starting careers were music ministry. And so music has just been in my life since before I was born, quite honestly. And so I rely on the words of the music and just listening to music. That's one of the ways that I de-stress, as we say.
For our listeners, and we certainly hope this doesn't happen, but we know it does, that unfortunately, as you say, end up in the hospital and they weren't planning to be there.
Right.
Maybe they were in an accident. Maybe they came through the trauma unit. Can they request a chaplain when they come into the hospital?
Definitely.
Many people may say, I didn't realize I could ask for a chaplain or spiritual leadership.
Exactly, yes. Many times patients come through, they don't realize that there is a chaplain on staff, or they think that the chaplains are only there if they're connected to a particular church or a denomination or a faith tradition. And we are there for anyone and everyone. We really want to help them in the midst of their difficult moment. And yes, make that referral. Tell the nurse, tell whoever it is that's in the room with you, if you want a chaplain to come and talk with you and listen and provide that spiritual and emotional support in the midst of that crisis, we want to be there for you.
My final question is one that I'd be remiss if I didn't ask.
Okay.
What called you to be a hospital chaplain?
My calling is a little different than some others. Everybody has their own path to getting to become a chaplain. My bachelor's degree is a BBA from TCU, and I thought I was going into international business, so finance and foreign language was what I was aiming for. And for 2.5 years, I pounded the pavement trying to find a job, and there just wasn't a job out there. They all said I was nice, but nobody was hiring. And so I began to rethink, what is it that I really want to do, and where is it that I really want to spend my time? And as I had that conversation with myself and God, it was really ministry and church, and my faith is really what I wanted to do. And so as I was at seminary, one of my classes was ethics, and during that ethics class, the professor started talking about chaplaincy and the fact that it's a marriage, shall we say, between theology and psychology, and that just clicked every button in me. I was like, that's it. That's exactly what I'd want to do. And so I pursued chaplaincy at that point. I thought the only way to be a chaplain was in the military, and I really wasn't sure that I was being called into the military. But it turns out that, yes, there are chaplains in hospitals. Where I got my training for education beyond my master's degree, I did a residency at Baylor University Medical Center in Dallas, did 6 units of clinical pastoral education. And then after that, I became a chaplain and been working as a chaplain, hospital settings, disaster relief, as I said earlier. I've also done sports ministry, and before I was in Dallas-Fort Worth area, I was in Houston working in a neurological rehab hospital.
And we're going to have to continue the rest of this conversation on our podcast, The Human Side of Healthcare, on all the major podcast players. Helen had a lot more to say about her work as a chaplain, and if it's something that you might be interested in as a career, she talks about the career path and how people are doing it as a second career. That and more in the podcast. And especially thank you, Helen, again for all you're doing for our community. Now, when we come back, Dr. Julia Cartwright from Children's Health is going to talk about managing screen time. Some great tips you can use while the kids are at home and prone to be on those screens. That's next on The Human Side of Healthcare.
We're continuing our conversation on how you can empower yourself to have the best health possible in today's ever-changing healthcare environment. This is The Human Side of Healthcare with DFW Hospital Council President and CEO Stephen Love and co-host Thomas Miller.
And welcome to The Human Side of Healthcare. We're glad you're back for another segment, and we're going to be talking to Julia Cartwright, who is a licensed psychologist at Children's Health and assistant professor at University of Texas Southwestern. Welcome to the show. We're delighted that you're on the show today.
Well, hi, Stephen. Thank you so much for having me.
You know, we're going to talk to you about a very interesting subject, and I think our listeners are really going to enjoy it. We're going to talk about screen time and media. So we'll start right off and kind of frame this. Do you think too much electronic media could have a negative impact on children?
Well, while there certainly are benefits to using electronic media, excessive use definitely has a large negative impact. The largest impact really comes because of displaced time or time that's lost while you're playing or using screens. So let's say a kiddo is using a screen for 2 or 3 hours in the evening after school. At best, the screen time can be set up as neutral, but there's always a cost of lost learning opportunities based on what they might be doing instead of looking at the screen. So that's social skills practice with other kids, physical exertion, relationship building, any of these things that they might just be doing even while playing with something outside of the screen. So it's okay to play with electronics for fun. Of course, our kids need a break, and that's the way a lot of kids and teens connect. However, they also need help setting and enforcing boundaries to ensure their electronic use is healthy. So we kind of think of electronic media like junk food for the brain. So junk food's okay sometimes, right? So we all have birthday cake, maybe you go out for ice cream with friends, or you have popcorn at the movies. But if we just had unlimited access, a kiddo might come home from school and eat a gallon of ice cream for their afternoon snack. So we just want to help them have some healthy boundaries.
Well, you know, when we think of electronic media, we also think in terms of video games. Is there a relationship or any definitive answer whether video games increase violence or aggression?
So that's a great question that a lot of people talk about often. Research really has provided evidence that video games have a significant influence on behavior, and violent video games do increase the likelihood for aggressive behaviors, aggressive thoughts, and aggressive emotions. So it's not a one-to-one connection. Not everyone who plays these games is going to struggle, but there has been evidence that links the two. And that might even be more of an impact with our kids with developmental disabilities, because kids with autism or ADHD have a tendency to get stuck on images, and they have a high level of arousal relating to visual stimuli. So that means these images that they watch might get replayed in their brain over and over again. Just makes it more likely that when they feel that aggressive or angry feeling that we all get sometimes, it makes them more likely that they'll act on it in a negative way. So while playing video games in moderation is okay, it's really only detrimental to play those video games that include hitting or stealing or shooting or fighting. Those are the ones that we really want to avoid, especially if your child is already having aggressive outbursts at school or at home. It's worth considering if the content they're looking at may be making it more difficult for them to avoid some of those behaviors like hitting or pushing.
People that do have developmental disabilities, do they have a tendency to use electronic media probably excessively? And if the answer is yes, why is that?
That's a great question. So, while all kids and many adults are drawn towards video games, research shows us that kids with ADHD and autism are more likely to spend more time on screens compared with even their own siblings. And that occurs because kids with ASD and autism and other developmental disabilities have specific strengths and deficits that contribute to that overuse. So we know these kiddos have a strength in processing visual information, and they also have some heightened sensory sensitivities or physiological responses to visual and auditory cues. And those video games are really visual, right? They have loud sounds and they have bright lights and constant movement. So you can really get your eyes glued to those screens pretty easily. And with our kiddos, all that stimulation is even more drawing than for typically developing kids. Some of the other things that add to this challenge are that kids with autism and ADHD often have fewer options for other leisure activities. Sometimes they find it hard to plan or initiate activities on their own, or playing with other kids isn't really very relaxing or fun for them. They might find it pretty challenging. And so that kind of leads to video games again, because video games give you a really clear structure of what you're supposed to do. They have a start, they have steps and a goal that you're supposed to reach, and you even get small reinforcement along the way with some extra points or nice sounds or little stars that you gather in the top of your screen. So video games really help our kids know what to do next, and it can be really entertaining in a way that's relaxing, like other types of play might not be. So you can see how they might really get stuck on them. And that's why playing in moderation is okay, because they deserve that break too, but we need to help them make sure they're engaging in other activities and have other learning opportunities as well.
So, what advice do you give parents when parents are looking to monitor media use or video use? Do you have kind of a yardstick, if you will, of advice that you give?
Sure. The first thing that I like to talk about is assessing the area of most concern. So some common areas of concern that come up are the length of time, if they're just playing too much during the week or on weekends, the content, so what they're actually looking at, and then emotional reactivity. So if there's a lot of conflict around the video games or whenever the games go off in the household, that'll help you kind of determine what's the thing that's interrupting your life or your kid's life the most. And that's probably where you want to start making some changes. Some changes that you might make. The first one I like to talk about is changing the environment, because these are changes that parents can make without really including the kids too much. So the first one is having all screens out of the bedroom and instead have them in a family room or a common room. Research really shows that there's an increased difficulty with sleep and a lot more likelihood for overuse if screens are available in the bedroom or are played or used independently. Then the next one is playing or watching together. This is one that parents can start today by just sitting down on the couch while their kiddo is playing or talking about shows that they watch together. This way parents can point out special things that they notice, maybe moments of empathy or good social skills in the characters, or they can point out issues or things that they're worried about that they might not want their kiddo to repeat or to be focusing on. Some other things that parents can do around the house is decreasing the background media, or if the TV's on kind of in the background all the time with the news or the radio's on all the time, it's worth kind of turning that stuff down to not be a distraction or to not remind the kiddos that there's media available to be used. Some other things that can be helpful are creating a new system. So really having new house rules related to media use. Some of my favorites are charging all electronics in parents' bedroom after a certain hour of the evening. We like to recommend 1 to 2 hours before bedtime, all screens go away. And one way to monitor this is just by having them charged in a specific location. Another might be earning screen time by doing social things. So maybe earning what they would regularly access as their screen time for the day by first playing with a sibling for 20 minutes or going outside or asking a neighbor to play. So just adding in a little extra motivation to do something social that might distract them from media use altogether. But then if they come back and they're ready to use their media after they have done their extra task to earn it, then that's okay.
Thanks, Dr. Cartwright, for some great tips. Her full interview is also on our podcast on all the major podcast players. Thanks for joining us today. We have more relevant local information during these challenging times scheduled for next week from the DFW Hospital Council. So stay in, stay safe, and we'll see you next week on the human side of healthcare.